नमस्कार दोस्तों, आज के स्पेशल यूट्यूब लाइव में आपका फिर से स्वागत है। जैसा कि मैंने कल कहा था कि आज हम किस्ट मेडिकल कॉलेज, जो नेपाल में मेडिकल पढ़ना चाहते हैं, उन सब बच्चों के लिए डायरेक्ट कॉलेज से इंटरैक्ट करेंगे और कॉलेजेस में क्या-क्या इश्यूज़ हैं, कैसा कॉलेज है, क्या प्रॉब्लम्स हैं बच्चों के, इंडियन बच्चों के लिए क्या फैसिलिटीज़ है, वहाँ के लोकल बच्चे और हमारे बच्चे कैसा-कैसा फैसिलिटीज़ वहाँ पर हासिल कर सकते हैं, मेडिकल पढ़ाई कैसी रहेगी, इंडिया से कितना अलग रहेगा और इंडिया आने के बाद क्या फैसिलिटीज़ मिलेगी। ये सारी चीज़ें आज हम लोग डिस्कस करेंगे, तो बहुत देर नहीं करेंगे। पहले मैं इंट्रोड्यूस करना चाहूँगा हमारे साथ डॉक्टर प्रोफेसर डॉक्टर सूरज जी हैं हमारे साथ। नमस्कार सर।
नमस्कार।
सो डॉक्टर सूरज, थैंक यू सो मच, आप हमारे साथ जुड़े हैं बिकॉज़ नेपाल को हम हमेशा हमारा सेकंड होम ही मानते हैं। पूरे इंडिया से हर कोने से बच्चे नेपाल में मेडिकल पढ़ने का एक सपना रखते हैं। जो भी बच्चा इंडिया में अगर किसी भी कारण से अफोर्ड नहीं कर पाता, वो हमेशा नेपाल को अपना सेकंड होम मान करके पढ़ने का ख्वाहिश रखता है सर। बट ओवर द टाइम फीस काफ़ी बढ़ते जा रही है। ये सारी चीज़ें इश्यूज़ आ रही है। फिर प्रोसेस जो है नेपाल में पढ़ने का, इसके बारे में बहुत सारे क्वेश्चंस रहती है। तो ये सारी क्वेश्चंस के हम आपसे आंसर लेंगे। बट सबसे पहले चाहूँगा सर, आप अपने बारे में कुछ बताएँ और जो बच्चे नेपाल में पढ़ना चाहते हैं, उनके लिए आप पहले क्या बताना चाहेंगे? उन्हें क्यों नेपाल आना चाहिए सर? प्लीज़ सर, आप कुछ अपने बारे में बताएँ।
Namaskar. Um, I can use both English and Hindi language. So I would like to introduce myself as Professor Dr. Suraj Bajachare. I am the hospital director and clinical coordinator of KIST Medical College Teaching Hospital, which is affiliated to Tribhuvan University, one of the world-renowned and one of the topmost university of Nepal. Okay, so I am a consultant orthopedics and spine surgeon, and I'm working in KISS Medical College for more than decade. So in the initial stage, I have been working as a lecturer, then after become associate professor, and now become professor, head of department orthopedics, and being a hospital director, I'm looking hospital services and academics too. So first and foremost, I would like to welcome you in on behalf of KISS Medical Management team, all of you present here. I would like to clarify your many queries you have in study in Nepal. I am one of the product of Nepal. I am the first batch of BPKHS Taran, and I completed my MBBS in 1999 2000, and then after I completed my MS orthopedics in BPKHS only. So I am a pure product of Nepal. So I'm proud that I am a product of Nepal and I'm doing a lot, but my fellowship is from different part of the world. So I'm doing my orthopedics and spine surgery for last 15, 16 years. So, it's more than 15, 16 years. So I think in Nepal, the medical education has been flourishing in different parts, and we are now one of the best institution in Kathmandu under the roof of Tribhuvan University. There are other private universities like Kathmandu universities, Purvanchal universities, and other independent institutes like BPKH and PHS PAS, Patan in Patan. But the Tribhuvan University being one of the oldest one, the curriculum of the institution is very much mature, very much progressive, and lot of like community based, problem based learning. And not only it is the curriculum is like Indian curriculum, but more than that, it is applied oriented. Applied means the MBBS curriculum is very much vast. You cannot complete in 5 years, though it is compacted. If you started learning MBBS only, it needs more than 10 years. Being a like professor, it's been like my career is being more than 20 years, and I am a student of medical profession. So you need to learn a lot of things during your process. But once you enter into medical profession, that is the basic degree is MBBS. That you means that you make a base. MBBS is the one of the base for medical educations. Now there are higher studies. This MBBS is just like entering into the school level of medical. So it's a 5 years, though it is claims to be 5.5 years is long. Once you enter inside, you even don't know how it passed 5 years. So when I entered my medical school in 1993, 94, from 1999, I can now imagine that that was a period that how I have finished that 5 years, learning, lot of things. And I being a, like now in 2021, I felt that that education makes us a very good base of education. So that's why another thing is, in Nepal, I think the medical education has been flourishing, because why? We are trying to have a like lot of activities. The central access attraction from different world international organizations has given effort to develop lot of activities in Nepal. So I'm talking about KIST Medical College. The KIST Medical College is established in 2006. So it's been like 14, 15 years down the road, and it started its MBBS from 2008. And it's been like more than 13 years that we have experienced, and we have come up with lot of best students, bit out of best students from our institutions, and they are they are having their post graduation fellowship in different subspecialties in different part of the world. So I have started this institution in 2008, and I am one of the person who has seen first batch of KISS Medical College since then. So I can proudly say that we have lot of uh, academic activities, and the strongest thing is our academics is one of the best. Another thing is, in the service sector, we have lot of hospital, even is transplant activities, arthroplasty, arthroscopy, GI, lot of activities, service activity, that you can ask me. So that this little bit of introduction I would like to share with you. So I think if there is any other queries that I would like to clarify you regarding the academics, regarding the hospital services, regarding the student life, because I being a hospital director of KISS Medical College, I would like to clarify in these aspects with you. Thank you.
Thank you, Dr. Suraj, for the detailed information. And as you being a doctor yourself and being a teacher of all the students who are going from India and also from different countries coming to Nepal, there are many things as a Indian parent have queries. There are many queries already coming up in our question and also in our message while we are doing this YouTube live. More than 16 people are already live and more will join over the time. So, sir, there are few questions we will be asking you directly because
Yes.
see, any student who want to be a doctor, they in India they study for NEET examination. They prepare for the NEET exam.
Yes.
After the NEET exam, when the results are out, most of the students who does not get seat in government college, they try for state quota seats in India, and if they don't get in that too, because there is very less seat, like almost 16 lakh students appear for NEET exam, only 8 lakh students pass the exam, and only 84,000 seats are there. Almost 7 lakh students who even qualify the exam and they deserve to be a doctor as per the parameter set by Indian government, even they are not able to get the seat. And even if they are managing a seat, the cost for medicine in India is even 1 crore, 1.5 crore. It is ranging as like it's no longer a profession where a student can dream about without having huge money with their parents. So here comes Nepal, our always the friend in need and friend indeed for all the students who want to pursue their career in medicine can have a career in Nepal with low budget. We will talk about the budget later, but first we must compare because there are questions. Why Nepal? If a student is not getting admission in India, why Nepal? So let us do some comparison, sir, because in India there is a particular way the medical education is planned. Is it same in Nepal or not? For that, I would like to ask the question. First question is, what is the curriculum during the first year in Nepal? Like once the student reach Nepal, what are the subjects they are taught, and when the exams will happen in the first professional, and how the whole course is divided into how the preclinical, paraclinical, and the duration of that courses. Please, if you can clarify about the duration of the program and how the subjects are allotted.
Yeah, very good question. That is one of the most important thing, that is how it starts. No, so first and foremost, as you said, that Nepal and India is like a brotherhood, and the language that we speak, both of we are very much friendly with Hindi one, and we are comfortable with English also, and you can learn. I just come from the examination, and there were a lot of Indian students. I appeared in fourth year exam, is university exam, and when I asked question in Nepali, they were fluent in English by the 2 or 3 years. It's so easy that I was really impressed with that speaking Nepali and answering the question rather than speaking in other languages. One of the best part is that. So we are very friendly, and it's an environment, and the culture is very much different, not different than India. So that was the comfortable things that you can feel in it. Okay, one of the great thing that your environment of learning is as you are in home. Second part is, once you enter into the medical college, the medical education is one of the tough most thing. But though we have, like, you have to enter first, second year, third year, fourth year, and 4.5 year. So, as you asked about the first year, once you enter into medical college, first and foremost, we taken care is your health. You will be checked up by health things. Then after orientation for few days, that you should be oriented with place, oriented with the faculties, oriented with the all of the activities that you need to from hostels to feedings to the. So there is a proper orientation of their of your taking cares. So then after in first year, we have like basic science. You start with basic science, not with clinical, though the clinical starts from first year onward. So there will be anatomy, physiology, biochemistry, pathology, microbiology. These are the 6 subjects that you have to undergo. And the beautiful thing about the curriculum is it is similar to the Indian curriculum, but it is much more organized, systematic, because the systematic approach in the first and second year curriculum. When you study our respiratory system, the anatomy of respiratory, physiology, then after microbiology, there's a biochemistry, pathology. So it's just like correlation of all the subject entering into respiratory, cardio, musculoskeletal, like that. It is systematic. So you will be very much friendly with these all subjects once you enter into the systematic approach. So it's a very in India or in Bangladesh that you need to learn about anatomy in block, then after in physiology in block, and in biochemistry in block. It's not like that. In Nepal, you will be taught in a one systematic approach. So it's a very easy. You start with anatomy, you end up with pathology. So you learn what happened to the lung disease in first year and second year only in different disease like respiratory, cervical, this cardiovascular, then after neurology, musculoskeletal, endocrine. So this is a systematic, beautifully organized curriculum. And during that period in interval, you will be exposed in the clinical aspect in systematic way weekly in the first year onward. So it's a proud thing that you being a doctor, you not feel that you are just learning 10 plus 2 only. So you will be attached to hospital from first year. In the first year, once you enter the second year, the frequency increases. Once you enter in the third year, then you will be completely enter into the hospital phase. That medicine, surgery, pediatrics, gynae are the major subject that you enter into, along with the community medicine and forensic medicine. And in the fourth year, you will be exposed to orthopedics, ENT, eye, psychiatry, dermatology, this emergency medicine, radiology, and dental. These are the subjects that you learn in the fourth year. In the fifth year, you will be again focused into the major subject like medicine, surgery, pediatrics, and gynae. And once you complete this 5 and 4.5 year, you need to enter into the university exam, and then after you enter into internship. So the system is very important because curriculum is such a maintained that there will be examination in every systematic end of a system, and in clinical end of the posting. So you will be so easily can pass once you enter into centop, then into university. So there is no like so that you learn, and lastly you have a final exam and you have to stress upon the examination. That is not the thing. That there will be slot of examination, there will be internal examination, internal marks, and your attitude, your behavior will be counted. So and last year, if you have some type of illness in between, that you need, we say that you have a history of like good results in other examination that you can go through a university exam. So that is one of the beautiful that lastly you if you don't appear in the exam in the last, then you can't appear in the university exam. It's not like that. You will have a like systematic internal examination in between. So this is how the curriculum goes as per TU curriculum. Okay. Mm. Any other things?
Thank you so much, sir. So there is a specific question about a subject, sir, because
Yes.
students who does not get medical seats in India, especially in government college in India, they choose abroad. There are many countries they choose from, like the Ukraine, Russia, Nepal, Bangladesh, Philippines. There are many countries, but there are very few countries which teach the subject called community medicine, which is a very
Yes.
important subject. So I would like to know about this, sir. That is the community medicine subject is taught in Nepal, and if it is taught, how the practical classes for the community medicines are given to the students who are studying in Nepal? Because this is a very important thing. Because recently a gadget has come in which NMC has put a guidelines that the curriculum should contain these subjects, and not just the theory part but also the practical exposure. But many countries, like I will not take the name of those countries, but many countries does not have the capacity to give the practical exposure to subjects like community medicine. So how Nepal goes about this subject?
Really good, because one of the two institution like Institute of Medicine, Tribhuvan curriculum, Tribhuvan University, and BPKHS, both are the community oriented curriculum. I'm being a BPKHS, we have lot of committee postings during my days. In TU curriculum, you can say that community medicine is one of the most important part in the medicine. That you go to the community, you have to go know the disease pattern. So in curriculum also first year you have to go in the field for 1 month. During the 1 month you have to go to the different health post or some type of PSCs, district hospitals, and then you have to collect the informations, disease patterns in first year only. In second year there is like in second year I think there is only the few community posting, but in the third year you have a family health practices that every week you have to go, you are allocated a family, to a 3 or 4 student will be updated of family, and you have to follow the family, the problems of family diseases, the different type of community problems, and you have to follow every weekly, and at the end of the year you have to present beautifully their family structures, and then after their diseases, how they come in hospital, how treatment cost, like that you have to learn a lot in third year. In the fourth year there is a management perspective of committee. There is also 6 weeks to 8 week posting in the fourth year. You will post it in the provincial hospital, district hospitals, private hospitals, health post, and lower than that. So you will be exposed with both the managerial part and both also the system how it approach, also the management system of the hospital. So the curriculum has included the curriculum of community medicine, a one of the most strongest part. In the first year you have to give theory and practical examination. In the third year you have to give a 50 100 marks exam. In the fourth year also you have an exam. So in the first year, third year, and fourth year, community medicine is one of the very strong part of the curriculum, and I think we are proud that we, the TU curriculum, we have to go to the district hospitals, or you will post it residentially in that places in first year and fourth year. So this is I would like to give you a message that this will give you a good, good human doctor. Thank you.
Thank you so much, sir. I didn't expected so much details about the community medicine as a subject, and at different hospitals and at ward level. Also, the students are interacting with the patients from the first year itself. I think even in India, the community medicine is not there in the first year.
Yeah,
It
yeah,
comes
that's
from the
true. That's true.
third
Yeah,
year onward. So,
it's a
like
very strong part in
yes.
curriculum.
Yeah, and that is the reason I think, like in terms of hunger index and in terms of basic healthcare of the children, Nepal has better
It's very good.
facility,
Yes,
better
yes, that is the one
numbers
part.
than India, especially in the rural areas of Nepal. the healthcare facilities, where in India, rural healthcare is very poor compared to even Nepal, even sometimes compared to Bangladesh. So these are the things where actually Nepal is doing quite well because of the proper teaching methodology and involving the doctors from the first year in those rural areas. So this is a great news, sir. And this, I think, the students and the parents who actually want to study in Nepal, they will be watching this video very thoroughly, because we are not talking about only those questions which many people talk about: the food, about the cost, about the issues, and everything about the hostel. Because here we will not discuss about that. And taking your time, being a doctor, I will always want the educational perspective of the thing, because other perspective we can take care of. We can maintain a proper hostel, we can maintain the food, but as an
Yeah,
education,
that's true.
as an educational hub, we are not, the students are not going for a luxury lifestyle in the college. They are going for the education, and this is their prime motto. So sir,
Yeah.
there's one more question apart from this, that the whole curriculum is designed to be taught in 4.5 years. So as now Indian government has made it mandatory that if the student want to study medicine abroad, they have to do the internship in the hospital of the college. So how is the hospital of KIST Medical College? Is the hospital there attached with the college, or it's a tie-up with the college? How the hospital environment of the college is, and how important it is to have a medical college attached with the medical hospital? Because there are many colleges in other countries, they don't even have a hospital. They teach on plastic bodies. They have a laboratory system, but no patients, no practice, no actual body to study on. How is it the system in Nepal? Please can you explain, sir?
A
Thank you.
really important question, that in the law only, the for the registration of the medical college, you need a, minimum of 550 bedded hospital working. One, without that hospital, that medical college is not registered. So you will be assured that the medical college must have a hospital. Another thing, the medical college is being scrutinized by initially by TU, IOM, and Nepal Medical Council. Now it is being scrutinized by Medical Education Council Commission, MEC. So every year they come in the hospital to inspection. They look after the infrastructure, they look after the patient flow, they look after the faculties, they look after the academic activities, and they look after the students facilities. These are the major point they look after. So no one, no medical college in Nepal can bypass these kind of things. So, as a KISS Medical College, we being established in 2006, we have our hospital more than 500. We have initially have 700 bed hospital, and once there is like fixed seat, like 100 seat, we have fixed our seat into 550. But existence, we have 650, more than 650 beds in the hospital, and we have all the departments. And you can imagine that we have all the basic departments with all the faculties. We have not now we have no one from India, all the Nepali faculties, from professor to associate professor to lecturers in each and every department. In clinical department, we are full of all the faculties in different hospitals. So so the hospital is in the premises of the medical college. And one of the beautiful thing is our basic science and the administrative block and hospital and dental hospitals are within the 500-meter periphery. And we have a huge complex. We have the 9-story building hospital. We have 5-story building dental college. We have 4-story building administrative block. We have the 5-story big basic science block. So this is the infrastructures we have around within the kilometer one area. So it's very easy for you to be there. So internship is one of the most important part in medical education, that they acquire the skill, knowledge, and it is 1 year compulsory. And being a clinical coordinator, hospital director, I'm strict about that. You have no leave, and you have to rotate in each and every department along with the community. I have posted 2 weeks to 3 weeks posting help post also to have exposure along with the medicine, surgery, pediatrics, gynae, ortho, these other subjects like emergencies, and then after dermatology, psychiatry. Psychiatry is one of the important. So each and every department we have a lot of patients to taking care of. They are exhausted. They, even the internship are given a night duties. They have to do along night duties along with the residents. So there is no worry about the posting during the intensive, I think. So I clarify your subject that we have a very lovely, I have shown in here my presentation also, that we have a very big, well equipped MISU, SISU, PISU. These are the highest things, and we are doing a lot of surgeries. Orthopedics. I am a spine surgeon. There are other my fellows doing arthroplasty, arthroscopy, hand surgeries, plastic surgeries, tumor surgeries. In surgery, there are a lot of higher neurosurgeries, gastrosurgeries, urosurgery, even a transplant, kidney transplant has been going on weekly. Every weekly, we are doing two or three transplant surgery. So you can imagine how we are doing these services. So there is no doubt in KIST Medical College that we have infrastructure, and we have academics, and we have the hospital services, and we have the well equipped laboratory service also, the advanced laboratory in our college. Okay.
Yeah. Thank you so much, sir. This is actually the insight which even I didn't know, that in the hospital, almost two, three transplant, kidney transplant, we like
Yeah.
it is not in
So
India.
imagine how much we are advanced.
Yes, yes, this is the perception is not true, sir. That the problem is in India, people don't perceive that there will be transplant in Nepal. They believe that for everything they have to come to India, but it is not
No.
true.
Yeah.
Sometimes they do come to India because maybe their relatives are there. Medical tourism is
Yeah.
famous, but it does not mean that during lockdown everybody died of kidney failure because there was no place to transplant. Every country has a self-sufficient doctors,
Yeah.
overall infrastructure, and KIST Medical College having like two, three transplant a week is a huge thing. And neurosurgery and all specialized surgery which I discussed about, I don't know, like even private medical colleges in India don't have all these
Yeah,
facilities. I
that's
am
true.
very
That's
sure
true.
about
I
it.
know that.
I'm very sure about it. So coming to the things you are saying about the faculty. So there are colleges in many countries, sir. MBBS abroad is a big word, and there are Nepali students also who choose other country to study medicine once they don't qualify or they are not able to get the seat in Nepal. You know that when they go abroad, there are many challenges because the lack of information and the consultant, even including us, they are not giving them the information which they need to know, because
Yeah.
the kind of information you are sharing, I don't have that information. But
Yes,
sometimes
that's
we
true.
say that we have all the information and we give wrong information. So that is the
Mhm.
reason I invited you, so that you can give the information which will be required during the education.
Yeah,
Visa and
that's true.
everything, this information is a very normal information. We can book the flight ticket, we can book the visa, we can arrange the hostel. But basic education we cannot control. So coming to that point, you tell us, sir, about the faculty, because in many countries they are taking 500, 600 students in 1 year just to study medicine, and the college campus does not even have 10 to 15 full-time faculty. So in Nepal, what is the total intake each year, and how many faculties are there in the complete medical college who are teaching these students? I just want to know the intake and the total teacher, so that we can calculate the student teacher ratio in a medical college, and how important it is to, as a mentor of the students, to be make them a good doctor. Because 10, 15 teachers taking the class of 300, 400 students, it is as good as watching a YouTube live or doing a video lecture. So how important is the number of teachers and the number of students meant, like the ratio of student teacher is important in a medical college. So please can give your insight about
Yeah, I think you will be surprised with our faculties, a lot of faculties, and I think initially, in past 5 6 years, there were no fixed seats. They used to come, the inspection will be done, and around 100 to 100 students will be 100 or 150 students are every year intake. But now, for 5 years, the MEC has given us one strict criteria that they had the highest number of the student intake is 100 in each medical college of Nepal, in every university. It has been already fixed, so it has not changed yet. I think near future it can be changed, but the I can say that there is 100 students per year intake. Okay. So for that, we have faculties. You said that faculty number of faculties, so you can count the faculties from basic science. Okay, from anatomy, physiology, biochemistry. Each department has 5 to 6 faculties in its departments, and in clinical, each department had more than 8, 10. So around, I think, more than 150 faculties are full time, all full time. We cannot keep part time medical college. Okay, so full time means they have to come at 8:30 and they have to go by 3:30 or 4. Okay, so sometimes they have to also spend time up to 5 6. Okay, these are the faculties from, and each and every department has professor. No, no, even all the department of the departments, 19 departments, I think 19 or 21 departments are lead by one or two professors, more than three. Or in surgery there are four professors. In orthopedics we have two professors, and then in medicine also there are three professors. In surgery, in pediatrics also there is professor, two professor, in gynae. So there are professor leading the department in all departments, along with associate professor, more than two or three associate professor, and a minimum of 3 to 4 lecturer in clinical aspect. So there are huge departments like surgery, medicine, pediatrics, gynae. There are a lot of work going on. So I think the ratio you can say is 1 is to 1.5 or something like that. 100, around 140 or 50 full-time faculties. And in Kathmandu, I think they are doing full-time only. You cannot allow part-time faculties in TU TU under TU umbrella. Okay. Any
That's great, sir. Yeah,
query?
that's great, sir. Sir, there are many questions also coming up, so I will try to make it fast because they are already half an hour
Yeah.
past and many questions are still pending, sir. So though
Mhm.
it is taking long, but I know these information is not there anywhere. Everybody is asking, thinking about the fees, food, but nobody is discussing about the faculties, teacher, curriculum.
Regarding faculties, you can go into the website also. All the
Yes,
name of the faculties are given. It is not fake that all the departments are led by
yes.
professors. Yeah.
See, the other countries, there are many countries where when we ask about the faculties, they don't even respond. There are people who message me, sir, please send me the student in this and this college. And then I
Uh,
ask, okay, send me the curriculum and send me the number of faculties. There is no reply. There is
yeah.
no reply. They claim to be the top 200 university in the world, top 500 university in the world in terms
Yes.
of medical ranking. But when it comes to education, basic thing, the patients, basic things, the teachers, basic thing, the curriculum, these three things they are not even updating. And this is
Yeah.
the reason I think NMC has bring this gadget to control these activities. Just giving the certificates to the student to be a doctor will not solve the purpose of the
Yes.
medical problem in India
True.
and in Nepal or any country. So, sir, there's one more question. In other countries, we have seen that the teachers who take the class, they only set the final examination paper, and this is the reason all the students who attend the class normally pass the examination. But once they come back to India, they don't pass the FMG exam. But during the course, they pass with 90%, 80% because the teacher who's taking the class and the final exam paper set by them, checked by them. So students are able to pass the exam easily. How the exam pattern in Nepal and how university exam and class exams are different. If can you give some insight about it?
Yeah, very good. That's true. Once a teacher will have always love and affection with the students. If we make a question and give them, then I think I would like to pass all of my students because I love all my students. That is not a way that a medical education goes. So regarding the examination pattern, the internal examination, given a point like 100 points, the 10 point or 10 marks is only given to the medical college. So internal examination, there will be a lot of internal examination weekly or monthly, but it carries only 10 marks. But 90% marks will be carried out by the university examination in the last, in the final year, in first year, second year, third year, fourth year, these years. Okay, so that is one of the thing. Internal marks is 10, but this 10 marks is very important in internal in the marks that will be added up in the final examination. And lastly, the university exam. Regarding university exam, there is a theory and practical examination. So theory examination is well set by the university. No one knows what question will be. Even I don't know because it is really a sacred thing. Okay, it's a sacred thing. It comes from the university. University come with the question sealed with that, and every exam is started in same time, same days, and in different part of the Nepal. Okay, so there is no question of like leaking of question or knowing about the question by even me or teaching professors from the medical colleges. It is said by the university. That is the theory part. Okay, regarding the practical examination, for the practical examination also, it is a very strict rule. There will be one internal examination or two internal examination along with two external examination nominated by the TU, that is from other colleges. So you have to appear the viva or long case or short case in first year in clinical practice in front of internal and external examination. So you don't have your thing that you cannot say that this is a very good student, you please pass or something like that. You cannot be. So in theory also the question is very tough and you have to appear in examination. And other is practical. In presence of external you can't do anything. If your student is doing good, then you get marks. If not, then you can't. That much you can say that this is a good student today, it's not appearing well or something like that, to in the practical examination. Otherwise it's a very strict examination each every year. Okay, so there is no worry. In first year and second year there will be theory and practical in basic science. In clinical onwards, the third year, fourth year, fifth, each subject has internal and external. If you are appearing in medicine, then you there will be two internal and two external examinations. Two professors from outside other medical college. It will be very secret. Who is coming? We don't know. That is allocated by the two university. You cannot even ask that in orthopedics. I want this professor from this medical college. Please send me. You can't go like that. Okay, they are sending the secret professors. Whatever, even if I like or not like, they will come give examination and they will give your marks. It will be sealed and sent to the university. So this is the one of the pattern that in first year onwards up to 4.5 year. So this is the pattern of overview of the examination, internal and external. So the 90% marks is university exam. 10 marks only given to the college. Okay, in each department in subject. Okay, thank you.
That's great, sir. So there are countries where there is chances of corruption, of taking money and passing the student, that
Mhm.
even student can't think about, and it cannot even happen in Nepal, even they want to do. If any teacher or any
Yeah,
student
it's very
think about
difficult.
that, it's impossible because they can get at me at max 10 out of 10, but 90 they
Yeah,
will never be able to
yeah.
in their
In
country. Yes.
practical, you can ask for, but in
Yes.
theory there is no chance anyhow because there is code number. In the practical paper, the roll
Mhm.
number is different, and once the paper is cut down, you don't know whose that paper is. The paper is checked by not me. My students' paper will be kept in the university and is sent to the other university. Any professors you can go. So
So
I
there
don't
is
know where
no
it goes. Okay.
Yes. There is no scope of corruption. There is no
Yeah.
scope of passing the exam easily. So any student
Yes.
who is watching this video should be
Yeah.
very careful that you go to
Yeah.
Nepal or you study medicine only if you want to study and thoroughly
Yeah.
you want to be a doctor. There is no
Yes.
shortcut to success in Nepal. And
Yes.
in medicine, in the
That's
field of medicine, there is no
but
shortcut to success.
I'm not giving them scary things that no, we
Yes.
are here to help you. You
Yes.
teach you a strong, good doctor. Please don't afraid of examinations.
Yes.
Examination is I'm doing examination. I'm even a professor. I'm giving examination every day. Okay. Don't afraid of examination.
Yes, yes, yes. Thank you so much, sir. So, sir, last two, three questions are there. One more important question is, sir, about the language. There are many countries where students are going, learning a new language, and then they are studying, and it's getting very difficult for them. Now, even NMC has clarified that the whole curriculum should be in English. So, I have first few questions, sir. What are the books followed in Nepal? Can you give name of the few books which is very common, like anatomy, physiology, biochemistry? Second, the language of
Okay.
instruction is English. Sir, I
Yes,
will just
that's
complete
true.
here. The language of instruction is English, but do the patients, the prescription, the diagnostic report, the names in the medicine, everything is in English, or is just the
Everything in English.
language is in
Yeah,
special?
that is everything in English, not in Nepali or other language. It is all the way of medicine is English. That is
Okay.
clear.
Even the
Even the
diagnostic
history
reports.
taking or anything you write, books, all things are in English medium. Okay, there is no worry. And another is
So
books. It's
yes.
really important. As you know that most of the books you follow is both the Indian books that I followed in years ahead. Okay, one of the thing. And also the standard practice of the books which is being used in AIMS or in UGI or PGI or in any other university of India is very available. So I think most of the anatomy, Gray's Anatomy is one of the Bible of the anatomy, but we use Chauresia or some the other Hamilton anatomy, and these are the common books which is available in India and Nepal. Okay, so in orthopedics also we have like Aplay's anatomy, Aplay's for orthopedics, which is common orthopedics for vascular, and also the Indian books. I can name a lot of the Ibnezer and Maheshwari. These are the Indian books. This is very good Indian books available in Nepal also. So it's very easy for you when you coming from India. You can have like books much more cheaper from Nepal in India. So there is no worry about books. So books are fixed. There is two type of books. One is reference books, another is the test books. So minimum test books you need to have in your own home. Otherwise, the reference books are available in the library. So you don't need to worry about the books. Books are they nowadays you can see the e-library. Okay, so all the books are available in e format, that is in PDF format. So you can have your in your laptop or in your nowadays big gadgets, mobiles. So it's really easy to get information. In my days, I used to have like crave for books. Nowadays it's very easy. You can find any books in any internet. You search it, you get it. Okay, so any information you can get from your YouTube. Okay.
So, and last three questions are there. The second question is that, sir, how about the disease pattern? Uh, in in Nepal, there are a lot of students. In India, there are a lot of students who study in India based on the disease pattern, which is very common in India. So similarly, the disease pattern is there in Nepal. What are
Yes.
the major disease? Because once they come back to India, the exams that will be conducted. This is a medical exam. It's not a exam where you mug up the question and give up the answer. So it's all about the practical problem-based learning, which you are talking about. It's all problem-based learning, and that's why you need hospital. That's why you need to go and visit the villages, the Jilla hospital and the small district hospitals where you actually see the patient. But there are countries where where the student goes and they don't find the disease which is common in India. So what are the major disease in India and Nepal? Are they common? And last question is whether the local students of Nepal, the Nepali students and the international students study together or not. Because this is very important to know, sir. There are many countries where the international students are being taught separately and the local students are being taught separately. And the international students, the teacher's frame of mind are that these are the students, they will not serve in our society. These are the students, they need not be learning so much. Let them pay the fees, let us teach them, and let them go back to their own country. Because if the local student and international student are studying together, as a teacher you have the responsibility, because these students will be the future healthcare worker in your country. So in
Yes, that's
the
true.
future healthcare of the whole country will be in jeopardy if the education is not good. But for international students studying separately, this might not be the case. The country will be thinking, okay, let them teach, let them go back to their own country where they are not going to practice anyway. So teach them whatever we want. Their syllabus is changed. The practical subjects are changed. So is the situation in Nepal in terms of disease pattern and local and international students studying together and getting the chance to practice in Nepal? All this information, if you can give in the brief, because it will sum up the whole discussion.
Okay, thank you very much. It's a very important question. The disease pattern is in India and Nepal and around the Indian subcontinents are similar. And I've been like taught in BP guides, and I've been to Lucknow, Delhi, and all part of the India during my course, during my different fellowship programs or trainings and conferences. That similar type of disease are available in this Nepal and India. There is no difference. Like most of the things are nowadays raising are non-communicable disease like diabetes, hypertension, these tumor cancers are coming up. But the most important part is the infectious disease. This part of the world, the tropical part of the disease, are more common in India and Nepal. So we find a lot of tuberculosis infections, viral infection, bacterial infection, different type of infection is one of the major chunk in in the practice of medical medicine. It's a lot different from the Western world. The Western world don't have such type of infectious disease more. They are much they have less information about that. But in part of Nepal and India, we have lot of such type of diseases, communicable diseases that we learn. That's why the community medicine is one of the strong part that you learn more about these diseases, because of like the pattern of living is similar in India and Nepal rather than in Western world. So this is pattern, you learn a lot of things, and this application of this disease is much more easier you when you go to back to the India and practice. So one of the most important in the fracture of in the trauma also, similar type of diseases, and you go and same treatment in medicine or pediatrics or any other diseases. So you don't worry about that. You learn one thing here and you have to practice, go back to India, and you will be nowhere. Nothing like that. You will be taught every aspects of disease, and most of the disease which is common in India and Nepal and subcontinents. Not only I say India or Nepal, it's also in Bangladesh or Pakistan or around these SARC countries. Okay, so one of the most important thing is that it is included in curriculum. Even it doesn't mean that it is more focused on infectious disease, not only in infectious, but also in non-communicable diseases. So you no worry about like you will be difficult in position after going back to the Nepal in India, or back to Nepal India. So another aspect is you have actually very important aspect that students from anywhere of the world, more is kept in the same classroom, same group. We do not discriminate that this is the is international student, this is a national student. Like, there's no discrimination. They will give full attention to all students as one. Okay, there is no separation at all. They are given preferences, rather they will be more preferential than the national students. Okay, so you will be given will be asked by the preceptors that what happening, your fooding or lodging or good not. There are a lot of questions they will be asking you. They will be caring, much more caring about you. But rather than discriminating you, separating you in education or any part, in or there are a lot of extracurricular activities in the medical college also. They are also involved in all the other parts. So I think it's a friendly environment. It makes a bond between the friendship between the medical students. And that, I think, there are a lot of students, so everyone has their own ways of learning and thinking. Even then, I think the we as a KIST Medical College encourage the close association. We make a group in clinical practice, and we do not discriminate that this is the international group, this is the national group, like that. So we mix up these students so that they can learn in group. And we send if they have in community, it will be easier for the Nepali friends along with them. So I think it's another big deal that we always see them as the same student wherever they come from. Okay.
Thank you so much, sir. This is actually very interesting to know, because these are the parameters on which I think the student must compare. Many people say that Nepal is a bit expensive. Everybody, there are many questions coming about the fees. Yes, Nepal is expensive compared to many countries because they don't have teachers. They don't have the facilities. Because if you are there are colleges with 20 teachers teaching 200, 300 students, and a college with 150 teachers teaching 100 students. You
Yeah.
cannot expect it to have the same fees if you don't pay the fees with which the doctors will be getting the salary. How can you expect a good education? If you are expecting a good education, you have to either pay for it or you get the merit about it. It is very, we are lucky that at least we are getting the same education, sometimes even better than many private colleges in India, at half the price of what Indian private colleges are
Yeah,
charging.
that's true.
So this is the comparison comes in. You can't compare the education of Nepal with many so-called developed countries, because in terms of development, the first development you have to see. for medical education, you need patience. And as you are saying, it is believed that there is no discrimination when you are allowed to touch the patient. There are countries where you are not even allowed to touch the patient. You study on plastic bodies. The students comes to India and they have not even given a single injection to a patient, and they
Yeah,
are
that's
coming to
true.
India because of the different race. If I say I am Nepali, nobody will say that no, you don't like look like one. If somebody claims to be an Indian in Nepal, there is no discrimination in terms of race, because we all look similar, something here and there. But
Yeah,
when you go to some totally different country, there is a kind of racism is also there. That is the reason you are not allowed to touch the patient. This
yeah,
is what I wanted to share, sir, because I have traveled more than 30 countries checking about the medical education in different countries. And these are the points which nobody bothers. Everybody says that this is a world ranked university, this is such a huge university. The graphical and the drone shots of the universities make it look beautiful, but nobody checks whether there is hospital, whether there are patients, whether there are real bodies or not, whether you are allowed to touch the patients, whether the medicine which will be given will be similar to that of India or not, whether the language of instruction will be similar. So everything today, sir, you have cleared. And now I will go from academic part to non-academic, one or two questions. Sir, about the holidays. How's the classes, weekly classes? Like how many days a week the classes are happening, and when the student gets holiday in a year? Because this is also important for many parents who send their student. When will they come back, and when they can spend time with their at a home in yearly basis?
I'm really sad to say that medical education is very tough, and you cannot get much leave or holidays to celebrate. As a medical student, you have a 6 days a week to work or learn. Okay, only the Saturdays for the first year and second year. Okay, in first year and second year, you will have a Saturday holiday, but Sunday to Friday you have to do complete till 4 o'clock or 5 o'clock. I think 5 o'clock. You have a theory classes, practical classes along with. Okay, so there is leave only for the any illnesses or some urgent work, and there will be holidays for Dasai. There is around 5 days holidays, and from Tihar and Chhat there is major holidays like 5 to 6 days. That is the major holidays, and some holidays for like we have a KIST days, that is the extracurricular activity week. 1 week that will be like for your game. There will be 1 week long stretch, and due to the curriculum package, there sometimes we have a winter holidays of a week, not more than that. So that comes around not more than like 3 weeks holidays per year, except the Saturdays. So one of the tough thing that you have to, once you go in the third year and fourth year, you have to have your Saturday holidays on till fourth year. Once you enter into fourth year, there will be no holidays, there will be night duties. Okay, so intensive in 1 year period, you are only allowed to take 2 weeks holidays, not in a stress, in this tough things that you going through. So okay, so there is no such big holidays or long holidays during the MBBS 5.5 years period.
So
Okay.
that's great to know, sir, because there are countries where the holidays is almost 1.5 month of holiday twice in a year. So the
No,
actual
not
classes
just
is,
that.
yes,
Not in Nepal.
yes, and not even in India. So the student who are planning to study abroad, they must not forget the whole purpose of NEET examination. The dream was to study in India. Now, once you are not getting the seats in India, and don't have the budget for private college, you just don't jump out of a country to a somewhere where the whole education system is
Yeah, that's
different.
true. That's
So
true.
you have to check what is nearest to India, not in terms of only distance, but in terms of curriculum, in terms of
Yeah.
education pattern, in
Yes,
terms
very
of
good.
overall study hours. Because there are in most of the countries they teach only 5 days a week, and that is the reason they teach for 6 years. The
Yeah.
curriculum in Nepal, what you are teaching in 4.5 years. Many countries, so-called developed countries, are not even able to teach in 6 years because there are so
Yeah,
many
that's
holidays.
true. That's true.
Because if you calculate 3 months holiday in a year, when they have to come back and they sit in
One year.
India, it is 1 year is gone. Then
Got
again compare 1 extra days of class in Nepal for 5 years. It is almost 1 year, 250
yeah,
days of extra classes. So
that's
what
true.
is being taught in Nepal in 4.5 years, the so-called developed country, high-ranked universities are
Yeah,
not
they can't.
teaching that in even 6 years.
Yeah, that's true. That's the one of the most important thing that you highlighted upon. Okay. Mm.
Yes, sir, because the thing is, these are the point the agents don't want to disclose. They
Yeah,
want to say, go to this country, it's a developed country, they are very forward, they have high machineries, but nobody says to use that machinery, the
yeah,
kind of skill sets you require, the kind of
yes,
language with which those skills can be learned, this is equally important. You
yes,
can't
very
have a
good.
CT scan, but you can't use it, so it's just
Yeah,
a toy for you. So
yes,
thank you so much, Dr. Suraj, and I will be looking forward to meet you in person as well. Like I am
yeah,
becoming your fan. Kind of the information you have given, I have not found a single teacher who have covered all the perspective of the student life during the medical course. Being in such a high designated rank in the medical field, still you are covering the questions which a normal MBBS doctors need to know, because
yes,
during
very good.
specialization the life is very difficult, it's very different, but during MBBS the basic disease is important. You need
Yes,
not
very
be
good.
having a supercomputer, did
Mm.
not need a hi-fi technology to do
Mhm.
MBBS course. It
Yes,
might be required in orthopedics surgery, it might be required in super surgery or
yeah,
some
that's true.
specialized
Yeah,
course. But for
yeah,
MBBS what you need is basic disease
basic.
pattern.
Yeah, you need a base and the base.
Yes. So, but the problem is the so-called consultant, they show the hi-fi technology in some
No,
countries and they send the Indian student. But that
no.
is not even useful, because to
Yes,
use that hi-fi technology, you first need to be an MBBS doctor, which is ABCD in field of medicine. So with that, I will like to end this video and thank you so much for giving your precious 1 hour, sir. And I
thank
will
you
be
very
grateful
much.
to you, because this video will help not just Indian students, but even students from Nepal, students from Bangladesh, and students from Bhutan and many other countries who dream to be a doctor apart from their countries. They can come and study in Nepal. So thank you so much, sir,
Thank you.
and God bless you. And we will
Thank you.
be meeting very soon in your campus, and we'll show the college to all the students. Thank you so
Thank you
much.
very much for your questions. Thank you.
Thank you, sir.
Welcome.
So this was Professor Dr. Suraj. He actually gave the detailed insight of the medical education, the insight which is important to complete your medical course. Medical course is not about the country you study. It's all about what the content you study. The content in terms of curriculum, the disease pattern, the importance of teacher, importance of the doing the course in the English language, importance of and not having a lot of holidays, importance of touching the patient, importance of going to the district hospital and interacting with the patient. Without these basic things, you cannot think that you can be a doctor. If you just want a degree, there are many countries who are giving you a degree for 10 lakhs, 15 lakhs, 20 lakhs. Even they have hidden cost. So I am not discussing the cost today. There are many questions being asked about the fees, about the cost. But first, learn about what you are going to pay for. Without understanding what will you be paying for, why to discuss about the cost is important, but first go through the curriculum of Nepal, go to the website of KIST Medical College. I will put it in the details. Go to the college website, check about the syllabus, check about the curriculum, check about the teachers. Who are these teachers who will be teaching you? Are they doctors? Are they professors? How they will be teaching you? If you can't check everything, you don't deserve to know the fees or either. Just don't check the fees and then start checking everything else. So that's why I'm not disclosing the fees in this video. We will make a separate video related to the financials, hostels, and other administrative things required to study medicine in Nepal. But for this video, I think if you want to learn about the actual medical education in Nepal, you watch this video from the beginning. There are many people who have joined late. I request you, with folded hand, if you really want to study abroad, watch this video. Even if you are not going to KIST Medical College, even if you are not going to Nepal, if you watch this complete video, you will understand the perspective of medical education, and then take the decision of whichever country you choose, whichever college you choose, and whichever place you choose to study medicine. Even if you're planning to study medicine in India, do check the facts and figure Dr. Suraj said, because he actually covered all the perspective which even required to select a medical college. Even in private medical college, you might be paying 80 lakhs, 90 lakhs, but are you getting those facilities? Is the hospitals there? Are those hospitals have the patient flow? If that does not happen, even if you're paying 80-90 lakhs, it's of no use. So with that, I will like to end this video, and thank you so much everyone who patiently watched this video. And I will again thank Dr. Suraj, who actually gave his precious time after the examination, after the classes. He actually helped us to understand the perspective of medical education in Nepal, be it any college. KIST Medical College is one of the top medical college in Kathmandu, in Nepal, to study medicine, and they have only have 33 seats. It is not the place where you go and buy the seats in the market. It's only for the student who deserve to study medicine. So if you want the proper information, proper details about the fees, please contact the number given below. Send your mark sheet, let us analyze, and then we can register you for counseling. With that, I would like to end this video. If you like this complete discussion with Dr. Suraj, please subscribe to our channel. And if you want more information, you have more questions which we have skipped, please put it on comment and I will cover that in our next video. With that, I would like to say thank you so much and Jai Hind. We will see you very soon in our next video. Thank you.